Welcome to The Exam Room with your host, Dr. Rhiannon Winsor. In this podcast, we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. In this episode, we explore what it means to truly think beyond task completion in healthcare. This conversation features Dr. Darlene Melk and Shantipriya Siriparapu as they discuss the challenges and opportunities of delivering coordinated, patient-centered care. From closing communication gaps between specialists and primary care providers to building stronger care teams through multidisciplinary huddles and on-the-ground leadership, this episode dives into the strategies that make a real difference for medically complex patients. It's a candid look at the human side of health systems, the people behind the protocols, and the effort it takes to align around what matters most, the patient. Let's scrub into the exam room.
My mom has a cardiologist and a nephrologist, and they are fighting all the time. Like, the nephrologist is like, no, that's not good for her kidney. She shouldn't be taking that. I'm going to lower the dose. And the cardiologist is like, no, you're not going to lower the dose. And then her PCP is really helpful in getting everybody on the same page and managing her care. I'm so grateful for that. Because I can't be there all the time. And it's nice to know that she has someone who cares. It's not just her doctor. It's somebody who cares about her genuinely. And then I think that kind of feeds into the next question about closing that loop. And you mentioned before, like the front staff all the way through all of the touch points, making sure that everybody's on the same page. And any comments that you have about what closing the loop looks like?
At a basic level, every single person has to have that annual visit, and every single person is at risk for cancer, is at risk from dying from the flu. You know what I mean? And I think having our entire health center staff aware of that. And that is actually built into the EHR. So it can, in an easy way, say, oh, this patient hasn't had this vaccine or this, cancer screening, for example. And so that's sort of the very basic level, that getting everybody on board at closing those gaps, I think, is important. And so, those incentives, that's why they're built for everybody on the team. It doesn't only have to rely on the PCP. But then, for those patients who do have complex medical conditions or even just chronic conditions that are stable, just having them come in, making sure that, as the PCP, and this is in total alignment with the patient-centered medical home model, which many health centers are PCMH certified or recognized. And so it is focusing in on that individual patient and their needs as they evolve through their life, their journey through their health. But ultimately, that the PCP or the medical home is where they pull it all together and then kind of close those kind of loops or connect those, specialists, or figure out, and I've had to do that. I've had to actually call urologist and a nephrologist, and I said, hey, let's have a quick video call. We've done case conferences on patients because there was just no communication, and it was wasting the poor patient's time, who's not easy for them to travel with a very medically complex child. And so sometimes that PCP can be the connector and then can save the patient from all this hassle and heartache, and make it simpler. So that's kind of what closing the loop to me is also. Mm-hmm.
Yeah, closing the loop comes in two different parts. Dr. Melk mentioned when the patient care is there, that's the patient loop that we need to close on the patient side. And then when you're talking about a loop on ABC and the FQHC side, I would like to say that, I just want FQHC's medical directors to realize that we are here to help you support with the data and anything that you need. So please reach out to me. I sometimes feel like I should message them once a week saying, I'm here, please let me know how I can help. But I have emailed a lot of times saying that this is what our plan is. Let me know what you think, and let me know if you have any questions, how we can help from our side. So I just want the teams to understand that we are here to help you in whichever way we can. Sometimes we have answers right there and we can give you the answers right then and there. If we don't have the answers, we will find it for you and we'll give you a solution. So that's what I want them to know, that we are here to help you out in whichever way we can, because ABC Network is helping you run the MSSP program. So we want to make sure you use us.
Absolutely. We're talking about closing the loop. You mentioned something about communication, which I think is super important. Sometimes, maybe a lot of times with organizations, the bigger they are, maybe the worse this is. But, information kind of starts at the top, and then somewhere along the way, it kind of doesn't filter all the way down to the front lines, let's say. So are there strategies that you use to make sure that that information is getting disseminated? You mentioned a team approach. Is there anything else that you're doing to kind of get that message through the organization?
I wish that I could say that we've perfected this. Communication to all the staff is definitely a challenge, especially given our geography. So our service area is the size of Connecticut and Rhode Island combined. And we have 10 clinics. And so it's kind of humanly impossible for me. And so that's why we have, I have 4 medical directors that are under my direction. I have a nurse, a director of nursing, who essentially supervises all the medical assistants. So I definitely rely on my directors and managers. And then at the clinic level, we have an administrative lead. They're called a health center administrator. And they meet every week and discuss different topics. But, I came to find out just recently that they had a lot of confusion about my team incentives and the trophies. So, you think you're communicating something out. So I'm trying now a slightly different strategy. I'm actually trying to have lunches around the clinics with the providers, make sure that they understand everything and ask their questions. We do virtual meetings, but those are difficult to engage everyone, and they're not attended by everyone because they're optional. So I don't find that communication to be the most effective way. So I think at the end of the day, just kind of taking the time to do what I call work rounds and where you actually get out to the clinic is probably going to be the best. And then again, a new approach I just launched last month at one of our clinics is patient-centered medical home also really promotes the idea of a multidisciplinary huddle, ideally weekly. It's always a question of time. And right now we're not in a position to block clinicians' time. But what I did take advantage of is that the team was already having a lunch meeting once a month. And I asked the health center administrator if I could have half of the time and to meet with our providers and to discuss the kind of medically complex patients that we share. And our 2 nurse care managers were there at that meeting. And so I felt like it was a good launch. We're going to kind of study this in a PDSA cycle, like a 90-day, to see if it turns out to be worthwhile. But I really am excited about carving out this time because we get to the clinic. We're so busy just seeing our own patients. Nobody takes the time to talk to each other. And so in this, what I'm calling patient-centered medical home huddle, provider huddle, or complex patient huddle, we're also reviewing any patients that have been in the hospital and why, and trying to understand. And so I think it'll just at least bring to our awareness who are the patients that are going through difficult time that go to that site, to that clinic site. So, and that any one of those clinicians may end up seeing them. And so they're aware at least of that patient. So we'll see, but that's my
That's
latest.
an excellent strategy.
Yeah, I love it.
I have been promoting that, for the last year, that the medical directors, I know you have so many under you. So I think if you are yourself not able to do that, if even the medical director sits and talk to their providers once a week or once in 2 weeks and discuss those complex cases, because for each medical director, whatever number of clinics they have, I'm sure there are quite a few of those medically complex cases. So I think if they can do it individually too, I think that will really help them know what is it that they're missing or what can they do better to prevent this medically complex patient from going to the hospital.
Mm-hmm. I love your innovative thinking. You're like taking what you have and kind of trying to repurpose it. I love that. I was having a conversation with the CEO about innovation, and he's like, oh, I don't know, maybe, in healthcare, we're not very innovative. And I said, well, I think we are. It's just that people in healthcare have a tendency to not like change. Right? And they're just kind of, this is the way we've done things and this is the way we're going to keep doing things. And maybe just as humans, we're innately opposed to change. And there's not a lot of early adopters maybe, but we could probably spend like a whole day just talking about change and those kinds of things. But I think that your ideas are really innovative and not pushing the boundaries too far, but I think that's really great. Thank you for sharing that strategy.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.